The founder of Black Women Arise Women's Health Foundation, Sebabatso Tsaoane, says a new women's health clinic in Botshabelo in the Free State will promote cancer awareness in disadvantaged communities. Tsaoane says sexual and reproductive healthcare services are limited as they are only offered at tertiary hospitals. Free State Department of Health, in collaboration with civil and health organizations, launched the I Women's Health Clinic services at the Botshabelo District Hospital. The health department says this initiative has highlighted the need to provide specialized healthcare services to all healthcare facilities in the province. Currently, specialized services are only offered at tertiary health institutions through referrals. For the first time, this hospital will have eye testing and women's health services. According to Cancer Association of South Africa, cervical cancer is the second most common cancer among South African women. It is the leading cancer in mortality. All right, for more on this, we're now joined by founder of Black Women Arise Women's Health Foundation, Sebabatso Tsaoane. She joins us now via our video link. Sebabatso, thank you so much for your time this evening here on SABC News. Of course, you've embarked on this initiative, launching this clinic in the Free State, particularly focusing on women's health. Tell us more about it.
Thank you so much for having me. So earlier today, we launched a colposcopy and LEDs clinic in partnership with the Free State Department of Health, as well as through the sponsorship of the Bristol Myers Squibb Foundation. So we've actually done quite a lot of work in terms of screening women in disadvantaged and hard-to-reach areas for cervical cancer. But we identified that there was indeed a gap to say, after screening these women, when they present with abnormal results, what do we do with them? And that's when we approached the Department of Health to say we would like to open a colposcopy and LEDs clinic, which is the next level of care after women have been found to have abnormal cervical cancer screening results. So that's what we did today.
Of course, very important also bringing these services to communities on their doorstep. How important is this for the women of Botshabelo?
It is absolutely crucial because, you know, we always talk about, first of all, the importance of decentralization, because we saw that when we refer these women, because they are seen at tertiary hospitals, there is such a big load that's there, and this results in long waiting periods. And of course, if you're dealing with cervical cancer patients, that long waiting period really makes such a big difference. And it is in that waiting period that many women lose their lives and others are lost to follow up. Some even move to other places. So it's really important for them to be seen on time. So this decentralization of taking the equipment and the clinic into a district hospital will really be doing a lot of work in terms of achieving that. And then in addition to that, we have our mobile clinic that we make use of to go into the disadvantaged and hard to reach communities, to reach women, like you said, at their doorstep. Also, you know, targeting these places where there's poor infrastructure, and because we know that the services that we provide are quite crucial for those specific women, because otherwise they would not have either the funds to get to the nearest clinic or even the time, because it just takes so long to get to that clinic. So it's going to save a lot of women's lives.
And so you keep on speaking about tertiary hospitals, and you know, there are really few and far between when it comes to many provinces in our country. How difficult was it for these women to get these services that you are providing to them, particularly when you talk about the fact that it was only tertiary hospitals that provided services of this nature?
It was extremely difficult. Firstly, because, like I said, the long waiting period, that you know, a woman will be told today that you have abnormal pap smear results, and then have to go after 5 months. And then sometimes when they have to go, there are also other challenges, and they're unable to be seen and all of that. And then in addition to this, they, like you said, they're quite far from where the women are. So this was also quite a big challenge. And what we did as Black Women Arise Women's Health Foundation was to partner up with our community healthcare workers to really physically go into these women's homes to support them through what can be a really intimidating experience in terms of navigating the healthcare system. And we were also able to assist them with transportation in terms of, you know, getting money to just get a taxi to be able to get to that level of care. But we found that this was not sustainable. That's why we saw the importance of really bringing the services into their community. And also, I want to add that in as much as this clinic is going to be, or is in Botshabelo, it's going to be catering for other neighboring towns such as your Tabantu and your Lady Brand and other towns closest to Botshabelo.
And there will also be a focus when it comes to cancer, and particularly with cervical cancer, as it's one of the common causes of mortality for women in the country. Looking at cancer, how important will it be for you to educate, women in these townships when it comes to issues around cancer?
It is extremely important for us to educate women and for them to be able to make informed decisions. And I think health education really is the backbone of our project. Rise Women's Health Foundation, because you can't really even think of doing a pap smear, or you won't even know what cervical cancer is and its dangers if you are not educated. So we've done a lot of work in terms of spreading awareness, making use of social media, but more than anything, we've also trained or partnered up with traditional healers as well as faith-based leaders, which are your pastors, to say we wanted to equip them with evidence-based health information that will then ensure that they spread the right information or provide the right health education for the women in the communities so that they can be able to make informed decisions. And I'm happy to also say that based on this partnership with the traditional healers and the faith-based leaders, we've been able to screen thousands actually of women because they really trust their community healthcare workers, and also just to demonstrate that we are in collaboration with them and we are partnered up with them.
All right, Sebabatso, thank you so much for your time. That is Sebabatso Tsaoane, who is the founder of Black Women Arise Women's Health Foundation, talking to us there about efforts that have been conducted in the Free State to help various women in the Botshabelo area.